So basically we'll start from the outside and we'll work our way in internally. So you have the scrotum, you have the testes, the epididymis, and from the epididymis, and there's a lot more tubules in the testes, but we don't have a model that shows them all, because I just think it's too muddled here to try to ask you questions on it. If we have time in lecture, I'll show you a slide of it. So the testes, the epididymis, and off the epididymal ducts, you have the vas deferens, or the ductus deferens. Okay, either is correct. Now, this is basically going to be wrapped with the nerve fibers and the blood vessels and everything in a muscle called the cremaster muscle, okay, which is basically all of this. The pink, it's called the cremaster muscle, and what it does is it basically is going to lower the testes, raise the testes and lower them in response to sexual arousal and temperature. Okay, there's a reason why the testes are outside the body. Okay, when the male starts producing sperm, it's too sensitive to temperature in the abdominal pelvic cavity to really, for the sperm to live. Okay, so it's much more tolerable for them to be outside the body. So they descend into the scrotal sac. That's why hot tubs are so dangerous. Okay, so I'll just mention my public service announcement. Always use protection, but don't think that some of the sperm cells, that they're all dead if you go in a hot tub. They may not be. But basically the temperature in a hot tub does kill most sperm cells. So basically that's why we have the cremaster muscle. It basically lowers and raises the testes. Now we'll see another muscle later on, the dartos muscle, which is down here. These little pink dots. Okay, and the dartos muscle is actually in the scrotum. Okay, and also, if you look at the lab book, they're also saying it's in the penis, which is something that when we looked at it yesterday, is something new, because I thought it was just in the scrotum. So, obviously, we'll assume the textbook is correct. But the dartos is the muscle in the scrotum that works with the cremaster, so that not only are you raising and lowering the testes, but also the scrotum. So, this, like I said, when you wrap it with the cremaster and the testes, you got what's called a spermatic cord. Okay, and the spermatic cord is this right here. And up here. Okay, and the spermatic cord, really, one of the places I could show it to you is right over here on this guy. These two structures here are the spermatic cords. And what it does is it basically comes up through the inguinal canal and the inguinal ligament. Okay, here's the inguinal canal. Okay, and it's going to come up over the urinary bladder. Here's your urinary bladder. Okay, what's this?
Ureter.
The ureter. Okay, and then what happens is the vas deferens is going to come back, and this here is the seminal vesicle. So the seminal vesicle is going to add fluid to the sperm from the vas deferens, and they're both going to meet in what's called the ampulla, which you really can't see that well. But what's going to happen is it's going to come into this tube here, and that's the ejaculatory duct, this smaller tube here. Okay, and the ejaculatory duct comes into the prostate, okay, into the prostatic urethra. Okay, and then the prostate will add fluid, and then what you get is semen. Okay, so here's your urinary bladder. Here's the internal urethral orifice. Here's the prostate here, and on the outside here's the prostate, the seminal vesicle. And you have your prostatic urethra. And then I mentioned last week that in the male, the urethra has 3 separate names. So as it goes through the prostate, you have the prostatic urethra. Then this here, this little area across, is the urogenital diaphragm. Okay, and so the little piece of urethra that's in there is called the membranous urethra. Okay, because it's in the urogenital diaphragm, membranous urethra. This little white spot here, okay, is called the bulbourethral gland, or Cowper's glands. What it does is it secretes into the urethra to lubricate the urethra for the sex act. Okay, so the Cowper's gland is going to secrete into the penile or spongy urethra. So from the membranous, you now go into the penis, which is the spongy or penile urethra, coming all the way down to the external urethral orifice here. Now the urethra is going to run through, the spongy urethra is going to run through the corpus spongiosum. Okay, that's the erectile tissue in red here. Okay, the corpus spongiosum has the urethra in it. You can see that here. Okay, you have the urethra and this is the corpus spongiosum. The two on the top here are the corpus cavernosum, and that's, you're only seeing one half of it, or one of them. This here, the gray, is the corpus cavernosum. Okay, and again, this here is the dartos muscle out here, and this layer in here could almost be considered the cremaster muscle, okay, which is sort of around the testes.
What about the dots?
What?
The dots.
The dots are the dartos muscle. Okay. Then on the outside, you have the glans penis, or the head of the penis, the corona, and the shaft. And this side is circumcised. This side is not. So this, you have the foreskin or the prepuce on here, okay, and that side's been circumcised. And then this on here, again, you can see your spermatic cord. Okay, you can see your cremaster muscle. And the dartos is down in here. Okay, and the gray here is, again, probably your cremaster, like on here. And that's the male.